hi, Alice. Thank you so much for being with me today.
Hello, thank you so much for having me.
So you are a currently practicing dentist and you are a spokesperson for the American Dental Association, correct?
That is correct.
That's pretty cool. Seems like you're the person to talk to. There's a lot going on in our world today, and I'm just excited to talk to you because I think that regular maintenance on our health isn't as talked about as it should be right now, considering. So, for instance, as the leader in dental care from the American Dental Association, how has the COVID-19 environment affected dentistry?
Well, in every sector of our society, COVID-19 has had an effect. Early on, in many states, dental offices were asked to just treat emergency patients. In many of the offices across the country, as things progressed and with the correct guidance, slowly the dental offices have opened. And I am so grateful for that because dental health is so very important. I think the latest statistic is like 98% of dental offices are fully open at this point in time. So how have things changed?
Yeah.
Well, you will notice perhaps many offices may be calling patients before their appointments and asking them questions like if they have a cough or a fever. You will notice that many offices may at some point when the patient comes in for their visit re-ask those same questions. They may take temperatures on those patients. They may say, wait in your car until it's your appointment time. I know in my office, we will text the patient. We will text them, okay, come in. They may wait outside the office if there's currently somebody in the office. The whole idea is to just minimize exposure to as many people as possible. So that's before the appointment. We may wipe down the chairs they're sitting in outside of our office, or if they wait in our office, you may find that happening. During the visit, you'll see, I mean, dentists have always been incredibly great about, you've seen us, we wear masks and gloves, infection control. I mean, we're very good at that for many, many, many years. But now we've added an extra layer because the virus is airborne. So you will see some dentists wearing these face shields. You may see more coverings in the actual dental treatment room.
Right.
You'll see different, maybe longer appointment times, maybe longer times in order to add necessary steps to keep the environment safe in terms of disinfecting for the patients and for the staff. And as a practicing dentist, it's very important for me to have safety be first for our patients.
That's really comforting. That's really assuring, I think. Because one of the things that I'm going to ask, I'm just going to go ahead right into that one is, you said at the beginning it was only kind of necessary emergency treatments. So now you're encouraging people to go back to their regular dental routine of like the 6-month cleanings, or are those also still being monitored and slim?
No, we are actually encouraging patients to take care of their dental health because it's very important. I mean, you can see certain things in the mouth that could be an indicator of overall systemic health. So while I'm not a practicing physician, I can see things in patients' mouths that just don't look right. And to be quite honest with you, I think many people visit their dentist more often than they do their physician. Perhaps they see their physicians annually. So it's very important to be on top of that. Now, with that said, you have to be comfortable.
Yeah.
You have to be very comfortable. And if you're uncomfortable, call. I've had my patients call me and I've gone through what they need to do. So, and there's other issues if you have somebody that has some underlying serious health concerns, or if they're aged. I mean, I have a 95-year-old mother.
Right.
I will clean her teeth, but I may clean her teeth when no one else is in the office. For
Right.
some of my aged patients or ill patients, they'll be the first patient.
Yeah.
So It's not one size fits all. It really isn't.
No, no. And it's nice to know that you, especially as a dentist yourself, are taking those precautions and you're looking at the patient and their individual needs and what they have going on. And I think that is very assuring to just the regular person like myself. I noticed on the American Dental Association, they have multiple websites, and one of them is called Mouth Healthy. And
it's great. That is the greatest consumer website. It will answer practically all of your questions.
We'll pick up the conversation with Dr. Boghosian right after this break. Let's return to our conversation with Dr. Boghosian now. It was really interesting to me, and one of the things that I found very interesting as far as just very timely for right now is there was a whole thing about dental anxiety and how to combat that. So it said 3 ways. Can you tell us what those 3 ways are according to the ADA, how to combat dental anxiety? Because that's a thing. That's a real thing.
Number 1, talk to your dentist. That's if you're anxious about anything, bring up those issues with your dentist. The other thing you could do are mindful techniques. Practicing breathing, practicing yoga, just deep breathing, and not yoga, but meditate ahead of time. Get your head in the right place. And then you can also just schedule your appointment at a time when you might be less anxious. I mean, if you have your appointment at 4:00 in the afternoon, you're gonna be ruminating about that thing all day long. Get it done early. So that's very important. But I think the key is to let your dentist know that you have these anxieties. That's key, because then you can talk through some things, because it's the fear of the unknown. And sometimes when we're fearful of anything, we conjure up all kinds of thoughts that necessarily aren't so. So, I think you can ease those fears by just communicating.
Yeah, that's great. And are most dentists like yourself following the same procedures that you mapped out to us about the disinfecting and the timeliness of the different appointments? Are most dentists doing the same thing, or is that also one of those call your dentist ahead of time?
Well, each dental office practices independently, but the American Dental Association has come out along with the Center for Disease Control. The American Dental Association put together an interim guidance kit that really is on top of things, that covers anything from talking to your patient about what's going on to making sure we're disinfecting properly. And they, along with the Center for Disease Control, have the latest scientific evidence as to what to do. So you will be seeing a lot of changes in dental offices, but I can't tell you what the American Dental Association has done for me. I mean, it's kind of, there's so many facts out there. There's just so much information, and they've condensed it and they've put it together into this, if I could call it a toolkit that is at my fingertips, that allows me to just say, okay, I will do this, check that off the list, I'll do this. But it's a lot. If I told you it wasn't a lot, it's a lot, but it's also very doable. And again, the key important thing here is that it has to be safe for the patients and everyone else in that office. So they did a great job. I can't thank them enough for that.
That is wonderful. This will be our last, I want to say, COVID related question, but is there a place where that information, that toolkit, so to speak, might be available to the patient?
Basically, the information in that toolkit is more tailored to the dentist. Okay. So I think it wouldn't really be, I mean, the patient, if they're concerned, could certainly go to the Center for Disease Control and see what's there. But I think that the information, and in addition to that, is just basically tailored to the healthcare professional. Okay. You can certainly, again, call your dentist, make sure that it's that your questions are answered and that you're comfortable enough. That's important.
That is important. That is very important. And it'll help us getting back to our normal, healthy routines in life. And I feel like just personally doing those things will help me feel like just our world's kind of coming back together again,
Right. This
Like, oh, I can go to the dentist. I can go to my eye doctor. I can go and deal with these just regular care, for myself that help me kind of just figure out my daily life even more. So that's really comforting to know.
And in fact, I actually have an eye doctor's appointment. These are cheaters. So it's so routine. I don't have prescription glasses, but I have an appointment with my eye doctor next week, as a matter of fact. So
there you go. From a doctor to a doctor. I love it. I love it. So going off of COVID related and just onto some, I'm just going to talk about mouth health now, because, I feel like from a beginning and early age, we're educated to brush your teeth and floss and do it, a certain number of times per day. But things have changed. They have different toothpastes out there, different toothbrushes out there. Is there anything about the regular routine that we practice with our dental health? Is there anything about it that has changed that you've seen as a dental care professional?
First, I'm going to start with what hasn't changed. And
Okay.
you touched on flossing and brushing, but you've got to do it properly.
Okay.
You can't just put the floss between your teeth and not do it right to have it be effective. And you have to brush properly. With that said, there are a number of different products that have the ADA seal of acceptance, that basically that seal tells you the product says what it says and does what it does. Okay. So if the product makes claims about what it does, having that seal on there lets you know that that claim is accurate and correct. So, one of my fellow colleagues called the drugstore dental aisle the dental aisle of confusion, because
yes,
there's so many things out there. But if you look for that seal, it can tell you exactly what that product does. Now, as far as new things out there, some of the powered toothbrushes can do the work for you. Now, if you use a manual toothbrush properly, it will do the job.
Okay, that's good.
There's nothing like going back to that old-fashioned piece of string called dental floss.
Right.
A manual toothbrush, and if used properly, it will do the job correctly. But again, I highlight has to be used properly. So, brushing 2 minutes twice a day with a fluoride-containing toothpaste, eating a proper diet, and visiting your dentist regularly are keys to a healthy mouth.
Stay with me for more after the break. Why should breath odor matter, especially if we're wearing a mask? Well, Dr. Alice Boghosian tells us why. I agree with your friend, because I personally have sensitive teeth, and toothpaste is a tough one for me, because I'm like, everyone says I need to use Sensodyne, but it's a little expensive. So is like an off-brand, are those okay as long as do they have seals on those, or how is that? Are off-brands okay? Do they still have ADA seal?
Off the top of my head, I can't tell you which products have the seal and which don't, but as long as you find that product, if you look at it and say, hey, I want to try this, look for the seal, because that will let you know it does what it says. And it says what it does. So.
Okay, good. I will do that. I'll pull a Kevin McAllister from Home Alone when he asked the pharmacist, is this
That's right. I love that part. When I saw it, I screamed. I love that part of the movie.
It's so cute. It's the best. I love that part too. Well, that's awesome. So we are actually airing this on National Fresh Breath Day. Did you know that there was one of those?
Now I do. Now I know. I'm excited.
It is. It's exciting. And it caught my interest, and it caught my producer's interest, because one, you never, that's very random. But right now we're all wearing masks, and we're all very aware. I know for myself, I'm very aware of my breath when I put that mask on. And it has made me, oh my goodness, I apologize to all those people that I've talked to after drinking coffee and like all this stuff. So why is our breath something we need to take notice of, or is it?
Well, for social reasons, it's
Right?
something you take notice of, as you said, but there could be a number of other reasons. Again, I touch back to underlying health issues that we as dental health professionals can find in a patient's mouth. I mean, I can't diagnose diabetes, but if there's certain indicators in somebody's mouth that could be diabetes or liver disease or kidney disease. In terms of breath, chronic bad breath could be a number of things. You want to start with the most simple of things, and that could be leaving food particles between your mouth, or eating certain foods, garlic, onions, coffee breath, all of that stuff will give you, will add to bad breath. But again, if it's a chronic issue, there's a more serious underlying health issue. And again, back to our point about very important to visit your dentist, because you can catch things early that may not manifest themselves physically, that won't start in the mouth. So that's very important.
Okay, so as far as some of those preventatives, I know a lot of time, we're like, oh, let me just grab a piece of gum, or let me grab that mint. What are some just kind of preventatives for our breath, like to keep it fresh?
All right, watch your diet. I mean, if you want to be very, very careful, I mean, in this day and age, we don't have face-to-face meetings anymore, but but someday. But if you want to be very careful, be very cognizant of the foods you eat, particularly the night before. Certain foods will hang around a little bit longer. Make sure that you don't have food particles in between your teeth, because those will stay there and cause bad breath. There are certain dental conditions that could cause bad breath, from gum disease to decaying teeth. So from a very narrow aspect of dental health, those are a few, but I already touched on some of the systemic health issues. So make sure that you brush your teeth for 2 minutes twice a day with a fluoride-containing toothpaste. You have to brush your tongue, because plaque can collect on your tongue. So it's very important. If you ever looked at your tongue, sometimes you may see plaque there. It's kind of gross, but you want to clean that off. So those things can certainly help. I have patients ask me about mouth rinses all the time. Do I need to use one, a mouthwash? And again, if it has the seal, and if you feel it makes you feel better or more comfortable, go ahead. But it's not really something that, unless your doctor recommends, your dentist recommends a mouth rinse for dental health reasons. But as a routine, it is not necessary to maintain optimal oral health. Brushing, flossing, again, properly, the way I described, is the way to do it.
Gotcha. Are there anything as far as like gums or kinds of breath mints that people should stay away from, that otherwise they think, oh, let me just have a breath mint, or let me have this piece of gum that'll help my breath, I'll be fine, I'll skip brushing my teeth, I don't have time, after lunch? Is there any of those that we should kind of stay away from?
Well, you want to stay away from a gum or a breath mint that contains sugar, because sugar will add to decaying your teeth. What will happen too is, if, let's say, you don't have time to brush your teeth, popping a piece of gum in your mouth will actually stimulate your saliva to start flowing. And when your saliva flows, it's like nature's cavity fighter. It'll wash the plaque right off your teeth.
Yeah.
So, I'll see a lot of decay in patients with dry mouths. If they are taking medication that causes their mouth to be dry, why do I see decay? The plaque sticks to your teeth. It sticks. And again, if you don't have a lot of saliva to rinse it off, you'll get cavities. So chewing gum after a meal, if you can't grab a toothbrush, doesn't work as well, but it does help.
Okay, that's good to know. I didn't know that. That's really good to know. Is there anything else that you can think of as far as from the American Dental Association, like places that people can go to find out if there are not only just COVID updates for what they're recommending, but just regular care for their teeth, or should people just go directly to their dentist?
Well, going to your dentist is good, but we don't see our dentist that often. So again, the consumer website called mouthhealthy.org is a great resource. I mean, you'll find A to Z, everything encompassing on that website. And I really, really, I'll go to it sometimes because I just want to see what's out there. And they've done a great job. I mean, the American Dental Association, from that website to putting together our interim guidance for this very difficult and challenging time we're living in, has certainly made it easier.
Good.
Easier. So
that's really nice. I like it. It was when I discovered Mouth Healthy, because I didn't know about it. I just Googled American Dental Association and that one popped up. I was very impressed that they literally had a search engine that said pick a letter and they will list everything.
It's amazing. It's right.
Wow, that's awesome. Well, Alice, we appreciate your time, and this has been really informative, and I need to see my dentist and get my cleaning because it's been a minute.
Well, I'm happy to have helped and provided as much information as I can, and I hope I've encouraged people out there to just stay on top of your health, and your dental health is a very, very big part of that.
It is. Well, I think you have, and I appreciate your time. Thank you so much, Alice.
Thank you.